If we have communities where we have enough capacity where we can put people who are positive with COVID-19 and have exclusively reserved for individuals who are positive for COVID-19, this reduces our need to try to protect patients from other patients because they're all positive already. We need to protect our healthcare workers and our service workers in those facilities. This gives us reduced burden on personal protective equipment, but it also can give us greater capacity as we put field medical shelters up, as we consolidate into single facilities, as we don't need individual rooms, negative airflow, isolation, etc. A vastly more efficient utilization of our healthcare system. This is all part
hitting the green in
of the
one
planning
here
work that we've done and are promulgating throughout our
33
healthcare
feet
system.
to
So
go.
that's our strategy. We're to keep building that capacity, though.
Very good.
Mr. Vice President, can you not use the military?
Go ahead.
Mr. Vice President, you talked briefly about trying to make information more accessible online. So can you give us a timetable for when you think a website will be available based on your conversations with Google? And secondly, and this might be to the broader team, can you also talk specifically about how many of these tests have been sent out to states and how many you still have to send out?
Well, let me say that we're working with Google, but we're working with many other tech companies, and we're truly grateful for the efforts of tech companies in disseminating best practices and guidance for citizens online all over the country. And today, those resources are available, and we literally heard not only from Google but from Facebook and Amazon, and the public spiritedness that's been reflected there. Is a credit to those great companies and a credit to all the dedicated Americans who work there. Our best estimate, and literally the team has been working around the clock since Friday, is that at some point early in the week that we will have a website that goes out. The purpose of which will be for people to go and first fill out a questionnaire so that they can identify whether they fall in the category that Dr. Birch described would indicate the need to have a test. And then once they go through that questionnaire, then our objective is, as more and more of these sites come online, run by state governments, working in cooperation with our team, our public health service team, and FEMA, and also working in cooperation with local businesses and retailers, that people will know how to not only find it, but also the objective would be for them to literally be given a time that they can go and report for the test. But let me let the Admiral speak to the timing on the testing and unpack that for you.
So in our design, I just want to emphasize
nothing wrong with
we talk about testing and we talk about so many things, but we're really talking about people. And we're trying to make this a very person-centric experience to easily access the system, to give clear guidance about how to go, when to go, information that even if you're not really indicated for testing, information you need to help protect yourself and your family. And then on the back end, very customized reporting. And we're talking literally about having telephonic services to call individuals who've been tested, let them know yes, no, and what the next steps are. So we've tried to really envision this through a patient experience. So let me talk about the testing. Progressively over this week, there will be rollout to different laboratories of approximately 1.9 million tests. There are many centralized laboratories, the behind the curtain that you never see after you give your blood. And you saw some of the CEOs in the Rose Garden last week, like Quest and LabCorp, that are fully able, ready to run. They have been testing already, but fully able, ready to run within the first part of this week, the very high throughput testing. The 2,000 laboratories that are around the country have a different platform, one that's amenable to so many labs, not the big, hugest, highest output, but very high throughput laboratories are progressing. They have to adapt the test slightly to the machines and get used to this. They will start lighting up Monday, Tuesday, Wednesday, Thursday. I can't give you the precise timeline, except it has been an absolute priority of the laboratory associations, of Thermo Fisher, the company that made this test. You heard the president predict that it might be approved within 24 hours. On Friday, I think it was 5 hours after that, in the middle of the night, that the FDA approved that. and that's the one that's going to be widely disseminated, high throughput, that's going to be available. So I know you want a specific time when these will light up progressively over the week.
About
When that
135
happens, it will be
yards
a
out.
centralized opportunity, like in the Quest and the LabCorp. There will also be distributed opportunities, like in all the major hospital systems and labs that are in your area. And then that number of 1.9 million goes up dramatically in the weeks coming forward. I'm not going to say that the lab testing issue is over, because it's not. It's entering the next phase. But the much higher priority now is, now that we have the testing available, how do we get people into the
I'm not
system
sure exactly
to be
where this will
tested
end up.
in the
Could be
appropriate
bad.
prioritized way? And that's what we've really been focused on: information, website, points of distribution model that are tried and true, enabling the states, providing them with equipment, supplies, know-how, and commission corps officers as needed to help man these or staff these as we move forward.
And this one's for Birdie.
So you'll see this rapidly developing over the week.
All right, guys, last question. Mr. Vice President, are you considering domestic taxes?
Mr. Vice President, market futures are down despite the dramatic move from the Fed that the President applauded, would suggest that there's still concern about that we haven't done enough to respond to the economic impact of this deal, or of the coronavirus. I'm wondering when specifically we're going to hear from the White House about how you're going to impact or help impacted industries, from the airlines, the cruise ships, and secondly, I wanted to talk about the legislation that came out. The White House fought to exclude workers at larger corporations from paid sick leave, and so I'm wondering what you say to somebody who flips burgers at McDonald's or works at one of these large chains that's worried about staying home and potentially missing a paycheck.
Well, first let me say we strongly support the House legislation, which, while it gives some flexibility to small businesses,
And after that,
which will
one
be,
under for the
will be
day.
reflected in the regulations going forward.
And now setting up
No
the par
American
4
worker should
tee.
worry about missing a paycheck if they're feeling ill. And we can't say often enough to our fellow Americans, if you're sick with a respiratory ailment, stay home. And as you've heard here today, over the course of this next week, we're going to see testing become much more widely available. Beginning in the areas the CDC will focus us as the highest priority. But working with members of Congress, we've made sure that not only is testing free, but we have every confidence that the extension of paid and family leave to Americans will be extended in a way that should give every American confidence. And let me say, with regard to the economy as a whole, I think the Treasury Secretary has been working very diligently on the President's behalf with the supplemental $8.3 billion bill.
I don't think he'll be too
The
pleased
House
with that
has now
shot.
acted on important legislation that we fully support, and we hope the Senate takes it up this week. But whether it be the airline industry, or the cruise line industry, or the hotel industry, as the Secretary said recently, we are in just the first few innings of this effort. And the President has directed us to bring the full weight of the federal government to bear to confront this crisis, first and foremost on behalf of the health and safety of the American public, but strengthening our economy, ensuring that those vital industries will be able to find their way through and grow strongly once this coronavirus has passed will be a priority. And we're already in discussions with members of Congress in both parties about that next phase of the support. But let me say, as I close, we'll be back in the morning tomorrow for a briefing, and also we'll have a health briefing in the afternoon.
From
But
18
again,
feet away.
I know I speak on behalf of the President when I say how grateful we are for all the governors in the country, for all the local health officials, everyone that's coming alongside Americans. We encourage every American to continue to use best practices and common sense, even if you're not in a high-risk category, as the vast majority of Americans are. Remember those people around you who may well be. Remember those seniors with underlying health conditions. It's the reason why you need to keep washing your hands. You need to keep practicing good hygiene, cleaning those counters and surfaces to make sure that we don't convey the coronavirus to them. And finally, let me also just let me add to all the wonderful accolades of the public health service personnel behind me. These are all heroes.
And as we check the scores here,
Yesterday, having seen the way these people drop everything and are rolling into this effort to expand testing across the country. It'll be these people in these blue uniforms that you see at an awful lot of these points of distribution, these community centers around the country. And for all they're doing today, for all each one of them done throughout their career, I know they have the thanks of this president, his vice president, and the American people.
Sir, how do you say that? Companies.
Well, it appears after an hour-long news conference in front of the press in the White House briefing room there that this briefing from the coronavirus task force led by Vice President Mike Pence has come to an end. You can hear that the
and he can't be too happy with that shot.
questions. But the Vice President and others on stage there have decided it is time to wrap this thing up. We heard a great number of optimistic statements there, including the fact that 2,000 labs across the country are going to be able to start testing for coronavirus on Monday. Now, with that, you might have heard Dr. Deborah Birx say, will come a spike in the number of cases. There are people out there who are currently afflicted with coronavirus who either may not know it or have not been tested yet. And as the nation gears up for more testing, and that's going to start tomorrow, the numbers are going to go up. But the Vice President said, practice best practices, wash your hands frequently, do all of the things that we are being told to do to try to reduce the spread.
I didn't really expect too much, given that lie.
In the meantime, related to that, New York Governor Andrew Cuomo has announced that all of the schools in New York City, Nassau County, Suffolk County, Westchester County will close this week because of coronavirus. The governor of California also has called for all bars and wineries to close and is urging residents 65 years of age and older to just stay home. New York and California, two of the hardest hit states by the coronavirus. Dr. Anthony Fauci of the Coronavirus Task Force earlier today said they have prepared for a sort of a worst case scenario. Screenings for the disease are taking place. Joining us once again, family and emergency medicine physician.
What we have for us is part 3.
Dr. Neshwat, did you hear anything in that news conference from the White House that particularly heartened you about the way the nation is preparing to treat this onslaught?
Yes, John. What I heard is exactly what we need. Expanded rapid testing. We need to know where we have pockets of high cases, because if we know who's affected, where those infections are, where the outbreaks are, we can take rapid precautions to isolate those patients and put them into quarantine to help minimize the spread of this virus so that we don't have a large peak and high trajectory of this virus. So that's very important to get this rapid testing out there. So they have a plan in place. That's great. We need to execute it and get these tests out to the country, to the different states and to the labs. Very important. And he also mentioned that they are going to prioritize the testing. It's going to be number 1, healthcare workers. That's very important because you have to have your first responders, your paramedics, your nurses, your doctors. They need to be well taken care of in order to take care of others. And then also the vulnerable, our seniors, those with underlying medical conditions. They are also going to be prioritized. So very important that we're going to have this expanded testing where we can test thousands of patients daily and then monitor and track the progress, these numbers with an online website that they mentioned. So excellent for what I've heard. Also, I was very pleased to hear about the supplies. Supplies are a critical issue. We cannot run out of masks, gloves, gowns. These are what we call PPEs, very important protective personal equipment. And also, of course, ordering of ventilators, respirators, these sorts of tools that are needed for those who may end up hospitalized. But again, those are usually the most vulnerable, which are our seniors over age 65 with underlying medical conditions.
The Vice President said that the community-based testing facilities, which are going to be opening apparently starting tomorrow, are going to be outside the normal facilities. It sounds like They don't want people tripping into emergency rooms and that kind of thing for their coronavirus tests. They're going to have dedicated facilities that maybe don't involve hospitals.
Yes, so they're partnering up with FEMA, which I think is an excellent idea, to create these little testing pods so that people can go and get tested if they meet those criteria. As it is right now, there are certain criteria that have to be met in order to be tested because we don't have all the tests that we need right now. So those will definitely help minimize the burden on hospitals, emergency rooms, and in urgent care centers. But remember, if you're unsure what to do, call your doctor, use a telemed service. If you have just a sniffle or, maybe a runny nose, don't go to the ER. Call your doctor or use a telemedicine service. Those are phenomenal services that can help direct you and let you know what you need to do and advise you further if you need to be seen or if you need to go to the emergency room.
Dr. Jeanette Neshawat, we appreciate your expertise. Thanks very much for coming in.
Thank you, sir.
So coronavirus deaths in the U.S. now topping the 60 after President Trump on Friday declared a national state of emergency, a designation that gives health officials access to billions of dollars to use in the fight against coronavirus. Joe Simonson is a reporter with the Washington Examiner. He joins us now. Joe, the nation is still somewhat split. There are people who are panicked, and there are people who are saying that this is a whole lot of hogwash, that, everything seems to be closing and, airlines, everything is being restricted. How long is it going to take before we figure out one way or the other?
Well, I think that's a great question. You're absolutely right that the country is split.
And I think he will be happy with that.
Ideally, if we did all the steps that the healthcare experts say that we could do,
final round score.
What we're seeing in New York, like you said, Governor Cuomo just shut down schools. If we can flatten the curve, as these experts say, we can really minimize the amount of cases and fatalities. Hopefully, the people who say this was all overblown and never a big deal will come walking out of this saying they were right. But I think, unfortunately, there's going to be a lot more significant steps that you're going to see local and state governments, federal governments taking before we get to that point. Dr. Fauci said we're at the beginning of this outbreak. I think that's correct. So I think it's going to take some time for the state that we're in, the crisis that this country is facing, to really start impacting every American if they don't think it's a big deal just yet.
And Dr. Fauci said in that White House news conference a few moments ago
final
that the
round
worst
score
is yet to come, meaning the number of cases is going to continue to climb, apparently.
Right, absolutely, and that's what I mean. To me, it seems distant. I've been hunkered down in my apartment. I don't know anyone, I don't think, with coronavirus, but I also understand it's very serious, and hopefully I want to keep it this way. I don't want to know anyone who contracts this, whether they're young or older. And so I think, unfortunately, in the upcoming weeks, you're going to see a massive rise in cases. That means people my age don't go to bars. Walking down the street in D.C. yesterday, I saw hundreds of people congregating in these bars. Don't do that. And I know it's uncomfortable for a lot of people. It's maybe you're going to create your own apartment. But like I said earlier, we want to come out of this entire crisis with, half the country or whatever, how many people saying this is all overblown. But to do that, we